Okay, is it HIV stroke AIDS? Is it HIV only or it is AIDS? Why is it always combined? Today we are talking about HIV stroke AIDS. Now, why is it called HIV stroke AIDS? Today I'm clearing the air and everyone who watches this video should be able to understand more about this disease. My name is Noamanya Davis. I'm a public health practitioner and a pharmacy technician. I do a program on YouTube. It's called Health Matters Uganda, and also on TikTok I use Davis Health Talk. On Health Matters Uganda, we bring a disease, explain it to people, and give them prevention methods on how they can avoid them or avoid all those illnesses. Now, why is it called HIV stroke AIDS? HIV and AIDS are two different things. How is it? HIV is the virus that brings you to AIDS. HIV stands for human immunodeficiency virus. That word virus at the end of the word HIV, it shows that this is an organism that enters the body and destroys your immune system, so that if you do not get early treatment, you will end up into AIDS. Am I clear? Human, it means it is in human beings. Immunodeficiency has the word immunity and deficiency. Deficiency means shortage of or lack of. So this virus enters the human body and brings shortage of or destroys the immunity system. And once the immunity system is destroyed, you will get AIDS. What is AIDS? AIDS stands for acquired immunodeficiency syndrome. So the moment this virus enters into your body, the virus is HIV, it destroys the immunity, the immune system of your body. You will end up getting the syndromes. Syndromes is like a group of diseases coming together. So today I want us to know, I want people to really understand why this disease should be prevented or should always go for early treatment. HIV stroke AIDS is a disease that has no cure. The moment it has entered into your body, the moment you acquire it, because you always acquire it, it is not inborn, you are not born with it, it is acquired. So the moment you acquire this disease, just know you live with it for the entire life. So let us always avoid this disease. Another reason why we should get worried about this disease called HIV stroke AIDS, the moment you get the disease, you will be on treatment for lifetime. You will always take medications from day one, from the day you will be diagnosed until you leave this world. So that's why we should always be cautious about our lives. Why should we be worried about HIV? This disease, the moment it enters into your body and it progresses to AIDS, which is the most advanced of the infection, HIV, it will come along with other infections, or what we term as opportunistic infections. These infections you will get include TB, meningitis, pneumonia, and very many others. Actually, I will organize an episode on opportunistic infections. Actually, even TB, I will organize an episode about TB. I will organize an episode on meningitis, and we also get to understand all of these diseases. So HIV is a deadly disease that we should all put measures against. Why should we get worried about HIV? HIV will always bring stigma or fear in you, because people, this disease is always judged. The moment you get it, people will always tend to judge or to discriminate you. So that's why we should always avoid this disease or put prevention measures against this disease. But the very good part of it is that when you get diagnosed with it, or when you have HIV and you get to know earlier, the disease is manageable. You can live with HIV and you do not progress to AIDS. You do not go to the side of getting other infections. So the moment you get this disease, you seek for early treatment. You can always live healthy and you manage the disease. You don't progress to getting AIDS. HIV and AIDS are very different things. So let us look at how we can avoid this disease or prevention measures we can have against this disease, AIDS. One, let us always practice safe sex. Yes, I did a video telling people to always do sex so that they can avoid stress and improve their mood and their sleeping habits. But in this case, let us have safe sex. How is safe sex practiced? One, consistent use of condoms. You can always use condoms full time when you are going to have sex, and always go for testing. You test your partner for HIV, you test yourself for HIV at least after every like 3 months. Even if it is your wife or your husband, always encourage you yourselves to always go for testing. Here you are not like getting worried like of each other, but you are doing protection, because I told you the moment you get this disease, it is irreversible. You cannot go back to your normal life. Your life will change forever. So always go for testing, always use a condom, and always look for early treatment. The moment you have HIV, you are HIV positive, always go for early treatment. The antiretroviral drugs are available, and people who are taking them are safe. They do not progress to the other part of AIDS. Another way we can always prevent against this HIV is to bring up this information to people. Most people do not know about this information, and they are ignorant about it. That's why most people are getting HIV. If someone knew that the moment you get HIV, you live with it forever, that thing, you stick it into your mind, you will always you will always be conscious before you take your life for granted. So we come here to educate you. This service we provide as Health Matters Uganda, we are based on YouTube. We will always reach far, and the moment people get to know about this, they will always take care of their selves. Another way we can avoid this HIV is to avoid the sharing of sharp objects, the needles, razor blades, and all other sharp objects. Let us avoid that one. Then another safe way or best way that people can always use is to go for preventive measures or preventive treatment. We have PrEP and we have PrEP. Those are drugs that you can use. PrEP, you use it before you get exposed. Then PrEP is what you take after you have been exposed. Maybe you have had unprotected sex and you go for that treatment. You get it and you are safe. Or when you know that you are going to risk your lives, you can always take PrEP, pre-exposure prophylaxis. That treatment, you take it before you maybe sleep with someone, so that you can protect yourself against the disease. Lastly, we call upon partners to come and collaborate with us. We raise a bigger voice to many people so that they can learn and live healthy lives. We call upon NGOs, we call upon the Ministry of Health, we call upon even individuals who are willing to support us on this program so that our information reaches far. But Doctors Plaza, we call upon you, come and work with us so that this voice can reach far. We call upon insurance companies to come and collaborate with us so that we reach far. If you found this video educative, kindly give us a like, share, comment your question. Our numbers are there. You can always call us so that your questions are answered. Let us meet in the next episode.